Hello everyone, I'm Dr. Magesh Thirunakarasu. Today we are going to talk about what are the life-saving medications for COVID-19 infection. Okay. So to begin with, what are the medications that are essential for COVID-19 infection? If a person gets diagnosed with COVID-19 infection, and then he consults with the doctor and they look at the CT scans and the blood values, everything based on these clinical parameters and the patient's symptoms. So they just categorize his patients COVID-19 into mild, moderate, severe. So most patients who are asymptomatic, they want to stay at home, right? Because they just want to take some symptomatic medications. They want to stay at home and eat well, rest well, drink adequate fluids, and then the whole duration of home quarantine will go easy. Like the whole 10 days or 14 days will go without any trouble or without any issues or without any worsening of symptoms. So they get better, and then some people, they just want to get their RT-PCR repeated, and some they don't want to get their RT-PCR repeated. They just as long as they're asymptomatic, that's fine. Okay, they don't want to get their RT-PCR repeated. But on the other hand, people who stayed home on home quarantine, despite taking their medications regularly, they still get their symptoms worsen, right? Symptoms worsening, what I mean, for example, there are indicators. Though these symptoms get worsened, you have to consult with the doctor, or you have to go to a hospital for immediate medical attention. What are those symptoms? If fever is not subsiding with the medications, if it is continuously like going up and down with a high grade temperature, or vomiting, nausea, or if there is a shortness of breath, you are not able to do your routine daily activities. Anyways, when you're on home quarantine, you are not going to do any work, right? You're just going to eat and then be isolated from other people, right? So despite being on home quarantine, if your symptoms are getting worsened, you have to go to a hospital for medical attention. You have to go get yourself treated by your doctors. Okay. And when symptomatic, we look at a few things: oxygen, pulse rate, and then the blood pressure, because these are the vital signs that tells doctors that okay, this patient is stable. We look at the patient's blood pressure. We look at patient's oxygen levels. We check the patient's oxygen levels with the oximeter. If the oximeter shows O2 level of 97 on room air with a heart rate of 96 or 80 on per minute, then it is okay. We say that okay, patient, we say okay, Mr. Prakash, your blood pressure, everything is fine. You can stay at home. Nalla saaptunga, nalla thoongunga, thanni nalla kudinga. We say things like that, okay, and then we send them home. Okay, home quarantine, if they are getting better, they're recovering very well, it's well and good. Some patients, some amount of patients, they get sick, they get even sicker than what they were, and then they will require some amount of oxygen because they run out of oxygen. All right. So when they get hospitalized, what are the medications we give? We just look at the patient's comorbidities. If the comorbidities say like diabetes, uncontrolled diabetes, or high blood pressure, or high cholesterol, and many other comorbidities like thyroid problem. Some people would have had cardiac bypass done a few years ago. Some people would have had a few stents put in their heart blood vessels, like placed. They would have had stents placed in. So they will be taking their regular medications. Okay. So when they go to the hospital and then when they get admitted, the treating doctor would give appropriate medications. What are the medications that will save a COVID-19 patient? Whether it is irrespective of moderate or severe. I mean, what are the medications? What are the magic medicines, right? That's what we are going to discuss here. Okay. First of all, main thing is the lifesaver medicine is oxygen. Oxygen saves lives. There is no doubt about it, because oxygen is the main important thing, right? So when someone has hypoxia, for example, hypoxia means that saturation level of oxygen, if it goes below 92, we call it hypoxia. As long as one has saturation level of more than 95, they can stay at home. With the other parameters are stable. As long as the other parameters are stable, high oxygen level of 95, more than 95, they can stay at home, right? And they can take the medications recommended by the doctors. But if the oxygen level is less than 92, or if it's coming down like 95 and then 94, 93, and if they find themselves very symptomatic, like if they find themselves having short of breath or persistent cough despite taking cough syrups and other medicines, in the hospital we give steroids. Steroids reduces inflammation. Steroids reduces inflammation markedly. Okay, so and then if the complete blood count shows signs of infection, of the white cell counts are elevated, and with the neutrophilic predominant white cells are elevated, we give antibiotics. So steroids saves lives here, and we also look at some blood parameters like D-dimer, LDH, to see whether the blood to check the blood viscosity, because the main thing in COVID is we don't want a blood clot formation. There's a shower of clots will happen if the disease gets worsened. The clots form, and then they just go and get occluded in tiny branches of all the organs. So that causes sometimes heart attack, sometimes it causes stroke. So in a blood vessel, there's a clot goes and gets occluded, the distant organ will not receive its blood supply. Okay, and the organ loses its function. If it happens in the heart, we call it heart attack. If it happens in the brain, we call it stroke. All right, so things like that. So we look at the blood parameters CBC, D-dimer. If a D-dimer is elevated, that tells us that okay, this person's blood viscosity is going up, and then he may get into blood clots. Okay, so we'll start them on heparin medication that will keep the blood thinner, right? Okay, if the patient is already on aspirin or clopidogrel, for whatever the reasons, they would have had a bypass surgery done, or they would have had stents put in, they would be already on aspirin and clopidogrel. On those patients, we should have to be very, very careful on starting on heparin, or we will have to adjust the dose of heparin according to the weight of the patient. Okay, so heparin, oxygen, and steroids save lives. If you ask me whether remdesivir saves a life, I'm not sure, because there is not a proven data that remdesivir decreases mortality. Of course, remdesivir is being indicated in patients with a severe COVID-19 infection, because we call it antiviral medication. It reduces the viral load. Okay, thereby it improves the patient's overall well-being. But mortality reduces, oxygen reduces mortality, the steroids reduce mortality, and heparin reduces mortality. And some patients, what happens from the day 5th or during the first week, almost by the end of the first week, there is a thing called a cytokine storm. This IL-6, the cytokine storm happens. When this happens, this will just form multiple clots, and then the clots showers and goes all over the body, and then gets attached, occludes all the blood vessels, right? So we don't want the cytokine storm to happen. So we always just keep doing some blood investigations to make sure that the cytokine storm is not approaching. Even though if the cytokine storm comes in or sets in, we will know by running this blood test. Okay, there is going to be cytokine storm, and there are some indicators in blood vessels, indicators in blood test. We know that okay, cytokine storm is gonna come in a day or two, so that the IL-6 or D-dimer or CRP levels or the LDH levels may be deranged than the normal values. So in these patients, we will be very, very extravagant, we'll be very extra careful. Okay, and we'll have to adjust the oxygen levels, we'll have to adjust the dose levels, according to the kidney functions, everything. All right, so in patients with a severe COVID-19 infection, we'll make sure that patient is on adequate blood thinner, patients on adequate oxygen, and then we taper the steroids dose if the patient's oxygen level is met, because we don't give a high dose of steroids in patients whose saturation is okay or close to normal. All right, and these are the main things. Oxygen is like when I'm so hungry, I get like a plate of biryani, I just eat it, right? Just like that. In COVID, oxygen is the main thing. Oxygen determines everything. So if oxygen is less than like 92% saturation on your pulse oximeter, it's a danger. It's a danger sign. Most people don't understand. They just don't get short of breath. Even if the pulse oximeter shows like 88, they may just sit and talk, and then they might say that, doctor, I don't feel short of breath, even though my pulse oximeter shows 88 or 92. As a doctor, we know, right? Hypoxia less than 92 is danger, and the heart rate is not settling below 100, then you will have to go see a doctor. Okay, these vitals are very, very important. That's why we advise most people who choose home quarantine, we'll advise them to monitor their heart rate and pulse oximeter. So the life-saving medications, as we discussed earlier, is steroids, oxygen, and there is a blood thinner, and in some cases we use some monoclonal antibody, is Actimra. We use when there is a heavy cytokine storm with a highly elevated interleukin 6. But we don't use this Actimra, this monoclonal antibody agents in all patients. We have to use this once in a while who deserves that medication. It's not for everyone. Okay, and remdesivir is also for severe COVID-19 patients. Okay, hope this video helped you. And as I always say, just maintain social distancing and wear a mask, a surgical mask, because since it's a video, I'm not using it, but I have it in my drawer ready. And please follow social distancing like 2 meters 6 feet. All right, and frequent hand washing with soap. Stay safe and keep others safety. See you guys in our next video. Bye bye.